I think first is being intentional about actually recruiting Black elders and older adults. The same recruitment strategies you use for a younger population or a different racial and ethnic group may not work, probably won't work for the Black elders. So being intentional about how you are reaching that population.
We believe that Black elders deserve more than just an invitation to clinical trials. They deserve trust, representation, and true inclusion. To ensure their full engagement, we must address historical mistrust by fostering transparent, community-led conversations.
If you want Black elders to fully engage in research and clinical trials, start by recognizing that those receiving support are as important as those giving support. To build trust, you must first build mutual respect.
Industry and others must be intentional about fostering a community of trust and transparency when discussing clinical research and the historical mistrust.
Ensuring that Black elders can fully engage in clinical trials boils down to 5 things: who, what, where, when, and why. Who must have access to clinical trials? Everyone, including Black elders. Researchers must design their studies to make sure that Black elders can participate. And researchers must work with the medical providers who are already caring for Black elders in their communities.
Is your research and clinical trial of interest to Black families, to the Black community? Have you checked in with individuals of this community, with this population, with this diagnosis to see if it's something that matters to them?
Research must meet them where they are, whether through culturally competent outreach, accessible trial locations, or trusted community advocates guiding them through the process.
If they have questions, answer them truthfully. If you have questions, ask them with a genuine intention to learn. And also, if you find yourself in spaces where they are supposed to be in and they are not there, seek them, invite them. Because by doing this, you're showing that you're ready to co-own projects, to co-own the mission to improve health and well-being in Black community.
We must create inclusive engagement strategies to bridge the gaps between researchers and elders. Connecting with trusted community partners is essential to helping guide and shape our conversations and strategies. These can all be done, but it takes commitment, intentionality, and compassion from industry, researchers, and others.
We must make sure that Black elders are aware of clinical trials. Information is key. Researchers must also speak to Black elders about the design of clinical trials and get their input before the research begins. Where Black elders must have access to information about research and clinical trials where they live, work, worship, and gather. And Black elders must be offered clinical trials as an option where they already receive their medical care. When? From heart disease to diabetes to cancer, Black elders must have earlier access to the latest and newest treatments, including those that are being studied through clinical trials. And why? Because now more than ever, Black elders, Black people across the lifespan, and everyone, everywhere, in every community should have access, must have access to the latest, most innovative treatments that are being studied in clinical trials.
Are you compensating the individuals, the Black participants, at a level that they need to be compensated at? All of this matters. All of this is important, and these are changes we need to consider.
We can't do it without you, and we need to prove it.